Hello, I'm Marcy Turcos, one of the Derma Sciences clinical field specialists. I've been a physical therapist for almost 10 years and I'm a certified wound specialist, and I've been practicing in wound management for my entire career. Derma Sciences is an innovative leader providing novel and technologically advanced wound care products. Medihoney is our most widely known and utilized product, offering a truly unique therapeutic difference. It has been proven clinically successful on a variety of wound types of both typical and atypical etiologies. Medihoney was developed to manage chronic and stalled wounds. A chronic wound is one that doesn't heal in an orderly process or in a predictable period of time the way that most wounds do. Generally speaking, stalled wounds are those that don't progress at least 15% in 2 weeks. Full thickness wounds should be showing signs of healing in the first 2 to 4 weeks. Partial thickness wounds should be showing signs of healing in that first week to 2 weeks. If pressure ulcers do not show improvement in the first week, they may not heal in a timely fashion. Venous ulcers not showing healing greater than 30% in those first 2 weeks may not be healed at 6 months. Diabetic ulcers that are not healed 30% in the first 2 weeks only have a 9% chance to go on to healing in the first 3 months. Honey, like silver, is a medical treatment that goes back thousands of years. We find evidence of it in ancient documents like the Smith Papyrus. The usage of honey declined after penicillin was developed, but in recent years the benefits of honey have been rediscovered. Derma Sciences is the global provider of Medihoney with active leptospermum honey. Its unique properties and mechanisms of action make Medihoney a very safe and effective product for managing chronic wounds. Honeys may look alike, but there are significant differences. Medihoney is active leprospermum honey derived from the manuka bush in New Zealand. This particular species of honey has unique plant-derived components, making it ideal for chronic wound healing. Medihoney also goes through a very complex processing cycle. Natural honeys may have microorganisms present, but in Medihoney, gamma irradiation will remove all of those. Medihoney is also centrifuged and then filtered. It's batch tested and subject to very rigorous standards. Medihoney's multiple mechanisms of action can help to jumpstart stalled wounds by affecting both debridement and the wound healing process. Medihoney's high osmolarity helps to cleanse, debride, and reduce edema. The high sugar content of Medihoney promotes a constant flow of lymph fluid, which contains plasminogen, to the surface of the wound. The plasminogen then converts to active plasmin. Active plasmin is known to cleave fibrin, which holds slough to the wound bed. Adding to this, Medihoney's low pH also has several positive effects. Protease activity in a wound produces slough. Lowering the pH of a wound bed helps to decrease protease activity and can reduce both slough and inflammation. A lower pH can help to increase oxygen diffusion. In one randomized control trial, where there had been no reduction in wound size for at least 3 weeks, after 2 weeks of Medihoney treatment, the average pH of the wound bed was reduced from 7.72 to 7.26. For every 0.1% decrease in pH, it resulted in an average of 8.1% reduction in wound size. Perhaps the most significant randomized control trial of Medihoney was the Gethin 108 patient study, comparing Medihoney to hydrogel. An average duration of the wounds was over 6 months, and based on the inclusion criteria, all wounds had to be covered in greater than 50% slough. At week 4, the Medihoney patients showed a mean reduction of 67% in slough, while the hydrogel group only had a 53% reduction in slough. There also was an average reduction of wound size for 34% for the Medihoney group, against an average of 13% for the hydrogel group. By week 12, Medihoney had achieved an average of 44% healing rate versus 33% in the hydrogel group. So Medihoney exhibits all of these qualities. It has a low pH and a high osmolarity. It's produced under rigorous standards. It's sterile, and it's completely heat and irradiation resistant. There have been 4 randomized controlled trials looking at the effectiveness of Medihoney, and there also have been over 100 abstracts presented on the topic. It has been shown to be extremely effective, and it is the most studied and proven medical honey available in the world. Medihoney has a wide spectrum of indications for stalled and chronic wounds, including diabetic foot ulcers, leg ulcers, pressure ulcers, first and second degree partial thickness burns, donor sites, traumatic wounds, along with surgical wounds. Medihoney helps to jumpstart healing in wounds resistant to other therapies. It may require fewer dressing changes. It's very easy to train your staff to use it, and it may help with patient compliance. One of the best aspects of Medihoney is that it can help to take the guesswork out of usage decisions. Medihoney comes in these configurations: the Medihoney calcium alginate dressing, the honey colloid, and tubes of 100% honey. Knowledge of wound science is increasing significantly every year. Dermasciences has dedicated itself to innovation and novel technologies that help this field advance. And Medihoney is the best evidence of our progress in this area. For more information about Medihoney and the full line of Dermasciences products, please see the other videos in this series.